Hi, my name is Jennifer Bramhall, and I am recording my personal philosophy of ethics in nursing. I'm currently working as a clinical nurse educator at the hospital locally here. Prior to that, I spent quite a few years on the nursing floors. What I've really enjoyed about the clinical education role is that I'm able to take the standards that I developed, the ethics that I developed, during that time that I was on the nursing units and disseminate that hopefully to the newer generations of nurses as they come through. So that's a fun way to give back, but I'm really excited to get back to the bedside and to direct patient care with going back for my nurse practitioner. So thinking back over the years and thinking about how ethics have evolved for me, I think it really begins with your own core principles. And for most of us, that's really going down to treat others as you would like to be treated, putting yourself in the place of the patient, and advocating for them in the manner that you would like to be advocated for. Um, our healthcare system is such fast-paced and such a frantic pace anymore that if we aren't able to be there and help guide the patient through that system, then it can just be overwhelming for our patients. Um, Even when they do have somebody at the bedside offering them choices, the short amount of time that they're given to make those decisions can make it overwhelming. They really don't have a truly informed decision-making process. So I think it's important as nurses that we recognize that and advocate for our patients, that we take the time to go to the bedside and ensure that they had all the information that they needed to make that decision. That is one of the benefits of nursing, and even as we go into advanced practice, something that I want to take with me is to spend the time necessary to give my patient the information and to give them time to make those decisions. Um, and another key aspect, I think, is really respecting that decision-making process. I can't impose my own belief system on my patients. I need to look at their unique situation and respect it as such. So if they do make a decision that goes against what maybe I would have done in that situation, my job is to simply to make sure that they have all of the tools that they need to make that decision, and then once they have on an informed basis, an educated basis, made that decision, then I need to be able to respect that and advocate for them in that decision. As we've kind of all touched on talking about end of life issues and things like that. And I think advocacy goes a long ways with that as well. So if our patients do have a DNR, DNI, helping families even to recognize that and to respect that. So it can be murky waters sometimes when we're trying to do what's best for our patient, respect their wishes, but then also bring the family into that decision-making process. If we think about moral ethics, I also think about work ethic as well. I see nurses out there that have a really high standard for themselves. They work hard, even when they're not busy with their patients, then they go and help out their colleagues. And I think that's really important. I was just thinking about yesterday at work, a physician asked me to come help set up a patient for him so he could listen to breath sounds. And when I went in there, the patient, of course, needed to be cleaned up. Basically needed a whole linen change, and instead of going and finding the CNA for that, I think it's important that we all are able to get our hands dirty and take care of our patient. So there's those nurses that are able to do that and willing to do that, and then you find nurses that are not very team-oriented and kind of work independently, delegating everything away that they can delegate. So I think it's extremely important that we work as a team, because in healthcare, you can survive on your own, but you'll never thrive until you're part of a good team that has a collaborative attitude. And when we think about team, we don't just think about the immediate team, but also the multidisciplinary team. So how am I reaching out to my colleagues? How am I including them in the multidisciplinary plan? How am I communicating? So communication is a huge part as far as our role as a nurse. I think another part of ethics is our professionalism, and that can be as simple as how we dress, how we speak to our colleagues, but it's also engaging in professional activities, staying abreast of the latest evidence-based practice and trying to implement that into our practice. Our patients deserve to receive the best care, so if we aren't aware of what that best care is, then it makes it a lot more challenging to implement. I think we probably all could just talk for hours and hours about the things that are important to us and the core philosophies. But for me, it all just boils down to if I keep it in mind that if I was in that bed, or if my mother, I use my mother as an example a lot, if my mom was in that bed or in that office, how would I want her to be treated? How would I communicate to her so that she would understand? And how would I promote her best interest? So I think if we keep that at the core of our values, then we really can't go wrong. Hopefully I haven't bored you to death. I'm with the rest of you about not liking this YouTube thing, so I'm sure as soon as this assignment is graded, I'm going to be taking this down. But I hope everybody has a good weekend, and talk to you later.